Let's have a look at another part of the survey, and the findings showed that doctors were also relatively unhappy with the level of nursing that they were receiving from their nursing staff, and also just really a shortage of service staff, of support staff for doctors in the country. Talk us through that.
Jerusha, I think I just need to be very careful about doctors not being happy with nursing. I think we work very well with our nursing colleagues, and quite frankly, we wouldn't be able to function without our nurses, quite frankly. They are probably one of the most important cogs in the wheel. I think what the survey was alluding to was what the nurses share themselves and have in fact spoken out on, is the critical shortage of specialist nurses we have. So we're a country that sometimes chases very strange policies, okay? And in the late 1990s, there was a move to close a lot of nursing colleges. And in fact, the current health minister, in fact, has spoken out about that and has kind of tried to turn that around again and reopen many of these nursing colleges. So we decided to pursue a policy of closing nursing colleges, and nurses had to be trained at university, and some of the key nursing colleges were made redundant, and that adversely affected our production of nurses in the country. That has had a very serious consequence, and we face a critical shortage of doctors. Well, the nursing shortage is as bad, if not worse. But at a different level is the specialist nurse capacity we have. And by that I mean, for example, the kind of nurse you would encounter in an ICU, for example. The kind of nursing staff you would encounter in an ICU are what you call critical care trained nurses. And these are nurses who've actually done their undergraduate training, but have gone on to do almost specialist training. So this is the specialist kind of nurse I'm referring to. And you'll be well aware that certainly within the private sector, and more so within the public sector, I've experienced it, that we have to temporarily close beds in an ICU situation because we simply do not have enough capacity and enough nurses to actually service the number of beds and the required patient, at least nurse bed ratio that is required to deliver optimal care in that kind of situation. But there are many long list of specialist type nurses, and we really haven't invested adequately in that area. Yes, there is a move to try and improve that. One of the problems that unfortunately had what I think one would call an unintended consequence was the development of what was the occupation-specific dispensation, the sort of change in remuneration for professionals in the public sector. I think you will well remember the 2009 doctor strike. That was really about the OSD, but just preceding us was the OSD and the change for nurses. And one of the problems is that specialist nurses weren't adequately compensated within that OSD, and the unintended consequence was people simply didn't migrate to want to do those specialties anymore. That is being addressed, and we are turning that ship around. But that, I think, is what the survey was reflecting, because that's what we find at the coalface. That is where our deep challenge lies.